Hi, I'm Dr. Laxman Bahroo. I'm a movement disorder specialist and a neurologist at MedStar Georgetown University Hospital in Washington, D.C. How is dementia different from Alzheimer's disease? So, Alzheimer's disease is a type of dementia. It's called Alzheimer's disease, the most common type of dementia out there, and it's slightly different than overall other types of dementias that you might have heard of, like frontotemporal dementia or Lewy body dementia or vascular dementia. Alzheimer's disease is a much more slowly progressive dementia occurring over years with issues with memory, short-term memory, as well as spatial issues. How is dementia different from normal aging? This is a very important question for folks to understand. With aging, our cognitive functions change. Our brains work differently. There are many things the brain will do well. We have a lot more experience with age. We have a lot more understanding, a lot more things to be able to relate to the information that's going on. On the other hand, some things slow down, especially in our digital age. Some things might be a little bit more difficult to grasp. Things that might be easy for your teenager or your 20-something-year-old child to be able to do easily may take a little longer. Some things might be a little slower to understand or formulate or process, but that is part and parcel of normal aging. If there's a concern about cognitive impairment possibly leading to dementia, then things may be more concerning, such as not being able to do the job you're able to do. Things you were able to do well a couple of years ago become more difficult. That's more concerning for dementia than I'm just able to learn new information a little bit more slowly than somebody who's 40 years younger than me. How is dementia different from delirium? Okay, dementia and delirium are very different from each other. Dementia is a process where the content, the items that you're thinking about are impacted. Delirium is when you're not fully awake. You're more confused all the way through. There's difficulty staying awake or staying awake for even a short period of time. Delirium is what we typically will see in the setting of the hospital, where somebody gets very confused, very agitated. They don't know where they are. They don't know what's going on. Whereas with dementia, the loss is subtle. It's more forgetting simple things, forgetting things that you learned yesterday. How do you do that again? What are we doing tomorrow? Things that I've learned more recently tend to be forgotten more easily. Thank you very much for joining me for NEI's Autocomplete.